For any CPD points, kindly email knhcpd@gmail.com or knhpharmacy@gmail.com. We'll put that up. My name is Dr. Agnes Karengo Karume from Kenyatta National Hospital. Welcome. Welcome, Prof. Martha. You can introduce yourself further and we begin the session.
Thank you very much, Dr. Karume. I think you've introduced me. I'm Professor Muthoni Mathai from the Department of Psychiatry, and I would like to thank you, Dr. Kenothia, and you and the team and yourself for inviting me and for this amazing work that you have kept up. I mean, it's really amazing that you're able to keep on doing this week in, week out, and keeping us informed, educating us, and not getting tired along the way. It's really something to be acknowledged. So I was requested to talk about COVID-19 and stigma among healthcare workers. I'll try and make it brief so that there's time for talking. And I want you to keep this in mind. Today it's me, tomorrow it could be you, even as we talk. Now, that looks like a funny introduction. Okay, stigma and discrimination against patients who have recovered from COVID-19 infection and healthcare workers has been documented globally. In some of the continents, in Asia, like India, it's been very bad. In Africa, some of the countries, in the US, in Central and South America, Mexico, for example, the healthcare workers have experienced a lot of stigma and even aggression from the community, because they are considered a risk to the community. There are a few countries like in the UK and Europe where health workers have actually been celebrated as heroes. And what we didn't expect to see is a trend in which health workers who have recovered from COVID-19 and tested, and who have had tested positive, are stigmatized when they return to work. This seems to be a new trend. Now, what we're talking about here is social and self-stigma, because social and self-stigma often go hand in hand. When we talk about social stigma, we are referring, in health, we are referring to a negative association between a person or group of people who have a specific disease. And the social stigma that involves labeling, stereotyping, discrimination, and assigning that person or people a low status, lower than what they previously held. I'll just give you an example, just to stop being too abstract, is that, for example, a Rose, it's just an imaginary, a fictitious person. Rose tested positive. Rose is an emergency nurse. All the emergency nurses are then considered dangerous and stay away from emergency nurses. That means they have been stereotyped, they've been labeled as dangerous and stereotyped, and they've been discriminated against in the sense that they are not given the usual opportunities that they have in society. They are excluded even from certain settings. Now, self-stigma is the process through which a person, in this case, for example, Rose, internalizes the social attitude, agrees with the stereotyping of emergency. I'm an emergency nurse. Emergency nurses are dangerous, feels shame and guilt, and withdraws and experiences low self-esteem. So these two things go hand in hand. Society stigmatizes you, and you internalize the attributes of that stigma. So we are talking here about a stigma because of fear, anxiety, and panic that has been associated with COVID-19. And this is not serious infection in general. Serious infectious diseases are associated with a wide range of attitudes, beliefs, prejudices, stereotyping, and stigmas. And then we have emotions, these emotions that overwhelm us and distort the logic of factual thinking and choices. And people start behaving in a way that is not quite comprehensible towards each other. Now, COVID-19 started or started its journey, if you can say that, with a language of discrimination and marginalization. We started hearing about the Chinese pandemic, okay? It acquired a name associated with a certain group of people. We started globally discriminating against people of a certain ethnic origin or racial origin. Even here, it became, they started also retaliating against Africans as if that Africans were the ones who were to blame for it. And we will see how that happens briefly. And it became also the old people pandemic, it became that and the other. And then even hospitals and health workers have been labeled as unsafe by the community. And this has had a huge impact on the way people observe the disease. It has become the problem of the other. It's not me, it is the other. So they are a group of us and the others. And when that happens, we have a serious problem. And now when it happens, not just in the community, but it happens within our health institutions, that becomes a serious problem, because it means our colleagues who get infected with COVID-19 and who are human like everybody else, we transfer this basic attitude of us and them to them. So they are no longer belong to our part of us. They have now become part of them, the people who you have to regard with suspicion, the people who are no longer to be trusted. And this becomes very, very, it's a tragic situation, let's put it this way. Because it is as if we are blaming them for making us see that we are vulnerable. If my colleague gets sick, I blame them for showing me that I am vulnerable. I can get it too. And they are we are blaming them for showing us that fear can come closer, can come home. And that is what we say, overwhelmed by emotions and treating things in a non-factual and logical way. Now, COVID-19 is, we know, of course, is a highly infectious, contagious viral pandemic, and we still don't know enough about the virus. And this makes the situation worse in terms of how we react. The threat to health workers is global, we know that, but becomes even more acute in our low-resource countries, where there is inadequate access to personal protective equipment. And what we do know is that it is not those, what we do know, it's not those who have recovered that are a threat to us. It is those who don't even know or have no symptoms. And in our setting where we are now dealing with a community transmission, which is high, it is out there. It's not even just in our hospitals. It's not about hospitals anymore. It's out there. Now, the psychodynamic theories, in psychology, we talk about psychodynamic theories, and we talk about theories that may help us to understand people's reactions during stressful situations, which is what we are having here. Now, the thing is that as fear and panic mounts, as it increases, very basic, what we call sometimes infantile defensive mechanisms kick in when people have poor coping skills. And it is true, not having been faced a lot with this kind of situation, our coping skills may not be very positive. So some of these include denial. This one you know very much about. Everybody talks about it, denial. Yeah, he's in denial. It can't happen to me, okay? And maybe this is not really what we're dealing with in our setting, but what we are dealing with are things like some defensive mechanisms like displacement, where you redirect your feelings of anxiety, fear, and frustrations toward another person, blaming the other for your anxiety. Like I mentioned, they've just brought it to me, at a subconscious level, that I'm vulnerable. So they are to blame for my anxiety. Projection. It's them who are avoiding me, not me. It's them who, when they see me, they turn a corner. It's not me. Your projections. Rationalization, which we use a lot because we come from a scientific community, where we try to explain using some kind of a sometimes half-baked logic why you're behaving badly towards the other person. How do we know? And this and the other one, that is rationalizing. You're trying to justify your position and your behavior. And I'm hoping that bringing this out will help us to understand, but also to change. Because we do know that the psychological effects of COVID-19 for frontline responders, health workers, they are exposed to a lot of psychological distress as they interact with and treat patients. Now, psychological distress, this includes anxiety, burnout, depressive symptoms, traumatic stress, moral injury, which we discussed in another session. But social stigma against health workers who have recovered exacerbates all these symptoms. They lead to tiredness, feelings of detachment have been observed from others, anxiety, irritability, insomnia, poor concentrations, indecision, degradation of performance, feelings of inadequacy and reluctance to work as they previously did, and low self-esteem. And these are consequences of social stigma and self-stigma. And as I explained earlier, social stigma is the precursor of self-stigma. Now, so what we want to think about, how do we defeat this kind of stigma? What can we do to defeat stigma against others and against ourselves? And the first thing is to acknowledge your fear and anxiety, and ask yourself, what is a positive word to deal with this? It's not denial, saying I'm not afraid. It's to say, okay, I have fear, I am anxious. How does this express itself in me? And what can I do about it? Is this fear justified or is it exaggerated? And if it's exaggerated, what can I do? So first, to acknowledge. The other one is the language. Mind your language. It's a language that we're using. Words are very powerful. Words can destroy just as much as they can mend and heal. So let's stop referring to our colleagues as COVID cases, not your colleagues, our colleagues, or victims of COVID. You know Rose. Rose is a COVID case. Do you know about her? Rose is a COVID. She's not a COVID case. Rose has recovered from COVID-19 infection. It's the same way we all learned in our learning days, and for those who are still learning, not to refer to patients as, can you take care of fracture number bed 19? It's not a fracture, it's a patient. Or the case of fracture. These are people, and let's stop talking to people as COVID cases. This is a COVID case. This is a victim. So mind your language. Stop spreading misinformation. We talked about this before. Check it out for some validity. Look, use some legit sites. Ministry of Health, WHO, not always legit, but well, CDC. Sometimes it's difficult to know what's legit, but stop just spreading from YouTube and from everywhere. Stop and think before you click to forward. Virtual infodemic is overwhelming us. We're spreading things that we don't even read. You just click and forward. And then talk positively. Don't be the pessimist, the negative talker. Talk positively and practice and promote the known preventive measures. Protect yourself, protect the other with the known preventive measures. Don't look away. point out and condemn stigma-related incidents by all stakeholders at the workplace. And if these are forwarded to you, reply and say, where did you get this information? You're spreading bad rumors. You're stigmatizing others. Do it. And then initiate healthcare worker support groups. Then welcome back and appreciate. Appreciate. Celebrate the heroes and heroines who have come back from whatever their isolation, from whatever being sick, and they're with us. We are eulogizing those who have left us. Let us welcome and celebrate those who have come back. And I think it should be some of the institutional trends we should establish, where if somebody has been sick or was told to go and for 2 weeks and self-isolate, when they come back, let's take that opportunity to celebrate them. Have a small function there to say, oh, we are Christians. If you are, I'm not saying everybody has to be a Christian, whatever you are, celebrate and give gratitude to those who are back with us out of isolation, out of ICU, out of wherever they have been, and they're well. So just to end this, I said I didn't want to talk much because maybe this is something you want to discuss more. We have a project which last time I was asked about, and what it's called is psychosocial support for frontline health workers during the COVID-19. And we've launched this project. This is a College of Health Sciences project. It's a telephone-based psychosocial support for all cadres of frontline health workers at Kenish and 2 other public hospitals. This doesn't exclude any person who has been tested positive or has been sick or whatever. And the project begins with a brief telephone assessment to evaluate levels of stress and see whether there's more that needs to be done. And after that, participants are assigned to a group which meets weekly online. It's a telephone platform. It is done wherever you are at an agreed time, and moderated by a trained psychologist or one of our psychiatrists or registrars in psychiatry, and or social worker. And the initial sessions deal with the current stress you might be having, psychological first aid. But the follow-up is the important thing, because the follow-up is a self-care accountability group sessions, which tries to build your resilience against distress, against burnout, and give you better coping skills with the situation. Thank you very much for that. And let me just end by saying we're in this together. Today it's me, tomorrow it's you. Somebody is calling me. And to quote that, feelings are the most delicate things in life. Never hurt them when anyone truly shows to you. Because a great saying says, today it's me, tomorrow it's you. Be to the other the way, treat the other the way you'd like them to treat you. Let's follow all those old sayings and be gentle with each other and ourselves. Thank you very much. That is all I had organized for now. So be available for any questions and comments.
Thank you very much, Prof. Mathai.
Yeah, I have put some contact information. Sorry, Dr. Karume, I almost forgot. Yeah, if you are interested, if you'd like to get more information about the project we are doing or anything, I have put some of my co-investigators. We are many, but just a few who you can contact, including my number, and you can, if you write it down and get in touch with us, we can explain a bit more on an individual basis. Telephone. Okay, thank you, Dr. Karume. Now I have stopped.
Thank you very much for that very precise presentation, Prof. Mathai. Indeed, it's a very important topic in these times. And just as a way of recap for those who might be joining us right now, we are talking about stigma among healthcare workers during this COVID-19. And we're asking, have you had stigma during this period? Have you experienced it? Have you seen it being experienced in some of your colleagues? And you're free to type in your comments and questions at the Q&A. One of the things that you've talked about is just the background, COVID-19 being a new disease and being discovered currently. The healthcare workers, we are really at the front line, and even in the way we are managing our patients, at the same time we are finding ourselves that we are victims of the same disease, and this can affect our mental health our mental health. So it's very key for us, and we've been given even how to defeat the mental health. Maybe Prof, you can tell us what are some of the signs or symptoms we might look out for. When do you know that you have reached the end, or when do you get to know that I need to seek care, that it is time to seek care?
Okay. What you need to look out for, one, is poor attention. When you feel like you were doing this and then you forgot you do the other one, you can't really pay attention even when you're relaxed and at home or at work. The other one, of course, is that feeling of dissatisfaction and sadness. Sadness where you can't even see, you just generally have a low mood. Sometimes you have anxious, you're not sure about things. You also might have physical symptoms of anxiety. Sometimes you wake up at night with palpitations. Sometimes you feel fear or something, as if something bad is going to happen. Then there is this excessive feelings of tiredness, which sometimes can even be confused. You might think, oh, I have COVID-19. I'm very, very tired and I'm tired all the time. Of course, that can be another fear, another sign of burnout. The other one is that feeling like you don't even want to get too close to people. You start avoiding people, you start self-isolating. And I know we are physical distancing even in the place of work, but when you just feel like you just want to be in that corner where nobody is ever, you want to do your 10-meter distance or avoid people. So these are some of the symptoms that headaches, insomnia is a very common problem. So there is that, and if you really have doubts about that, this is where you'll seek help and say, what can I do? There are also some things that you can do for yourself. I mean, and that's why we are saying propagating self-care. Self-care habits are so important at this time. If you've never done them before, this is the time you really need to do them. And we do have assessments that we do that can tell you what level of anxiety, what level of depression you might be, burnout, and say, what can we recommend?
Indeed. Indeed, very important, very important. So when you have some of these symptoms or feelings, please do seek help. As you've been told by Prof, there's already a helpline also for healthcare workers. There are ways in which you can seek help. Don't be overwhelmed. It can be a very difficult moment. You're dealing with the patients, and maybe yourself, you're even a patient. And when you come back to the work, we are saying that it's us healthcare workers, the way we refer to our colleagues when they come back to work, are we saying, she is the one who was positive, he is the one who was positive, and avoiding our colleagues. There is a question here by an anonymous attendee. How do we handle healthcare workers who have just gotten positive COVID-19 results? Maybe this is a question of how do we handle getting the results or giving bad news. It's a way of giving bad news because maybe you didn't expect it and you've gotten positive results. How do we handle this whole scenario?
Yes, okay. First is empathy. It's like I'm saying, it can happen. Today it's you, tomorrow it's me. So we need to have a lot of empathy. Stop starting to look, lakini siku ingine nilikuwa na hukuvaa, you are not wearing a mask. I don't know, I saw you doing, stop trying to look for the reasons why it is them and not me. Clearly, give empathy, give them positive messages, tell them, okay, this is the situation, this is what you need to do, because I'm sure that in your workplace, there is always a clear indication. You have protocols about what should be done, but you do not run to the other side. You do not increase your distance. You continue protecting yourself the way you have before. Remember, we're supposed to be protecting ourselves. I can see Dr. Karume is wearing, I'm not wearing a mask because I'm sitting at home. So, but that is what you need to have, empathy. Empathy is treating the other the way you yourself would like to be treated if this happened to you. Think about that.
Yes, indeed. Treat others as you'd like to be treated. And one of the things we've also said is how we refer to each other, not just saying it's this is a case. The way Prof said, sort that fracture. That is a person. So the way we talk, and just some of the things that we've talked about. First of all, acknowledge the fear and anxiety. It's there. Acknowledge it. That you might have this fear, might have this anxiety as you're going to get these results, because yes, we are at double risk. We are taking care of the patients who have tested COVID positive, and we are at risk both from the community and by the nature of our work. So we acknowledge that fear and anxiety is there, and let us use language towards that will promote will decrease this fear and anxiety, and spreading the right information and positivity. So in what other ways do we support our colleagues? There's one who's asking, okay, apart from this, you have not even, okay, a colleague, a relative who is having increased anxiety due to positive results. In what other ways can we support them? Yes, we can give them the number that they seek help, but in what other ways do we support them? In what other ways do we know that when HIV first came in, we had the same issues we have with COVID. The way COVID is managed. When you're positive, everyone around you is careful. You don't even see the people who are treating you. They're all in masks. There's one patient who was telling us, I don't even know who is treating us. They're all covered up. So it increases that fear and anxiety. In what other ways, Prof, can we just handle this whole situation?
I think the thing that we're wearing masks is important. Of course, we have to wear masks. But the most important thing is to verbally introduce yourself with your mask. I think one of the proper, continue practicing good bedside manners. Introduce yourself to the patients. Even if don't remove your mask, but introduce and explain, I'm wearing a mask. I know you cannot see me, but this is my name. You'll get to see me from time to time, okay? Now, what else do we do to people we treat them the same way we would treat others. First of all, if this is your relative and they have a positive whatever, it is not your decision. That you cannot treat your own relatives. You cannot tell them, those are mild symptoms, please let somebody else make that decision, because if you make that decision and this is your relative and something happens and it goes bad, you will have that guilt. So the decisions about your relatives must be made by somebody else. So if they are going to be told to self-isolate, they must self-isolate. So it is not for you to be visiting them. If you have to do their shopping, you can do their shopping and bring it. You can talk to them on the phone, but you cannot say, but it's my relative, so I have to go and see them. And if you do, make sure you take the same precautions that you would take if you were going to see another patient. But encourage them, give them positive messages, and keep in touch, even on telephone, so that their hopes are raised. We know that the mental state has a big impact on whether people recover or not, and whether they live or die. People give up too soon. Encourage them to fight.
Thank you. Thank you for that. Another question here is, what about if that stigma is coming from the patients that we are seeing, such that in some situations you find that maybe the patients know which healthcare worker had been treated. And so there's double stigma, if that's the case.
Yes, that's unfortunate, and that's bad, but it's not as bad as when it is coming from ourselves. It's bad, but we know that we should know better than the patient. We can explain. You can tell the patient, at least this person has recovered. We know this person has. You don't know about the others, all the other doctors. Some of them had tests, some have not. You don't know about your neighbor. You don't know about the person you buy from. But so this is not the person that you need to fear. And just use your words to explain to them. You tell the patients have to take precautions. Doctors have to. Everybody has to take precautions. Everybody has to use behavior that is protective. And so it is bad, but you as a doctor should be in a position, or as a health worker, as a nurse, as a clinical officer, as a psychologist, you should be in a position to explain to them and tell them these are the facts. This is what we know about this, this is what, and so you do not need to fear that person. And I think information, giving them the correct information is very, very important. But let us start with ourselves. If we are the ones who are having a problem, we know that healthcare workers have been stigmatized. I mentioned this. Even aggression has been in certain communities. But let us deal first and foremost with ourselves, and then we'll be able to deal with that.
Indeed, it starts at home. And what I'm getting, even personally, is a lot of communication. We need to communicate both ways, because as I've said, it's a new disease. What are the facts? What facts are out there? What can we put to book? Let us be the ones who are spreading the positive messages and really surround ourselves with positive messages. Let us be the ones spreading hope and giving the right information, because even to our patients, to our fellow healthcare workers, it is us who are giving that information. So let us not be our own enemies by spreading false information, or by keeping this, or by telling others, oh, this is so and so is a case. That one is wrong. The other question is about burnout. I think we've answered that partly. And it's in regard to how all this stigma can lead to burnout. Maybe a comment on burnout.
Yes, we did mention this, Jesse, but it's okay. Self-stigma and social stigma increases burnout because it increases those symptoms of unhappiness, feeling a lot of discomfort at your place of work. If you go to work and you know that people are avoiding you, they are whispering, COVID amekuja. You don't want to work there anymore. You don't want to work there, and you don't want to work anywhere. You just wake up in the morning and you just can't even get out of bed. So there are symptoms, all the symptoms that you expect of depression, anxiety, suicidal ideation, feeling like you've lost hope completely. And then added onto that, those feelings of guilt and the feeling like you're to blame for what happened to you. All this now, which are symptoms of self-stigma, of course, that all adds up to burnout. And you lose pleasure in work and in all other areas of your life.
Yes. All that leads to burnout, and we've learned some of the ways that we can recognize this and also deal with it. There's a comment about the burial protocols, and this has been something that has been mentioned even in the social circles, especially at the onset, how the burials are being carried out. We are having a lot of people coming out and saying they didn't get an opportunity to speak to their relative. They didn't get an opportunity to feel that they had practiced their own rights in burying their relative, in burying their friends. And you know, just prior to death, you're not allowed to see your relative, you're not allowed to see your family. And unfortunately they pass away, and in the manner in which they are buried can cause a bit of mental distress. How do we handle this, or what are some of the ways that you can do about this?
Yes, that is one of the problems that we do have, and we have to acknowledge that that's a problem, because we have a lot of rituals that are tied to saying goodbye and to accepting that somebody that you're close to has really gone, and that includes being able to see and see they're really dead, and being put them in the soil, going through all the rituals that we do, whether you wail or whether you keep quiet, whatever your rituals of mourning are. Mourning is really a very important part, and unfortunately in this case we have a situation just like with the Ebola, that they do not allow contact with people and the bodies, and I'm not a virologist, so I can't even say whether the viruses are there in the dead person or not, so I would consult a virologist on that. But we know that the policy has been to be a kind of very sterile thing. I think the most important thing is for people to reinvent mourning rituals. In this case, let us mourn in a different way, because we're not going to gather 100 people in a compound and start letting out our expression. And in the end, you find that a good number of the people also get infected. So we have to reinvent mourning. We have to establish the new ways. We have to pave new ways for mourning, and we have seen people doing a lot of social media rituals, and rituals are there and must be there. And maybe when this is over, revisit the ritual. You know, visit the grave. Sometimes people die, and in most cultures, people also have some kind of rituals they have for somebody who gets lost, somebody who drowns and is never found, somebody who, you know. So there are always alternatives. They may not be the best, and it's very difficult to change the cultural ways of mourning, and definitely that has an effect. But we have to reinvent, find new ways. But mourning is important.
Thank you. Indeed, it's a difficult time, but we have to come up with ways in which we can handle this and really take care of our mental health during this period. The other question is in regards, how do we handle stigma in the community or at home? In that, even without being positive, as healthcare workers, you're still regarded as dangerous, you know. When you go back home, you have your family and friends, and they know you're from the hospital setup. And so everyone avoids you, and there's negative talk. Maybe just a recap of what you said.
First of all, with the physical distancing, you should not even be getting close to your neighbors. Okay, when you go out, let's maintain always that distance. Sure, we have had this problem, and it's been a global problem. There are some, like we mentioned, a few countries where there's not such a big problem, but in some others, people will even chase you away from the village. But so information is what you need. I'm sure that all health workers have had some basic training on how to behave when they get home to their families. And make sure you follow those procedures, okay? If it's, make sure that during the day you're taking the precautions that you need, because you know, at this point, the problem is not even about health workers. It's about community. You know, the transmission is in the community. So we shouldn't be worrying that, but okay, the community still thinks health workers, yeah, dangerous people. But I think information is the best thing we can do, and with our families. But let us continue maintaining the preventive, protective measures that have been prescribed and have been found to be useful. If you're meeting your neighbors, make sure you maintain that distance that has been prescribed. You make sure you're wearing your mask. you be the one to show them how it's done. Not the one who is walking and then you pull it down here and then you laugh and you know, at each other at this distance. Be the one to set a good example and show them, you know, I work, don't deny, say, I work in the health system. And we know and we want people to behave in this way to protect ourselves. You have to protect yourself and tell them it's not just about me. You don't need protection just from me, but you need protection from the others as well. And I need protection from you. You know, it's about me protecting myself so that I protect you, and the other way around. I think these are the messages that we have to give out there.
Okay, sorry. So continuous communication and putting in the measures. Is there a situation whereby, as a healthcare worker, you can discriminate against yourself? If
Yes.
you're talking about how is that? Can you talk a bit more on that? Yeah.
Self-stigma, that's what we
Yes.
mentioned. Self-stigma. We said it's not just about social stigma. Social stigma gives birth to self-stigma. Self-stigma is when you internalize that which the others have saying about you and you behave and feel accordingly. In other words, they say that one is dangerous, you feel dangerous. And you feel you don't want to go near them because you are not good enough. You feel like you are guilty. Guilt. No, nobody should start walking around feeling guilty that they got an infection, which is everywhere. You can't afford to do that. Feeling guilty, feeling worthless, that is self-stigma, where you internalize the attributes that have been projected to you from the other people. So you have to remember again, and this is where I say that support is important. Support and social and group support is important. Somewhere where you're getting the affirmation, I'm as good as I used to be. I'm not worse because I got infected. Anybody can get infected. And I'm here. I have recovered. I should be celebrating and not feeling like, you know, I'm something that's bad, you know. So I think it's very, very important to affirm to yourself. And this is where you need coping strategies.
Coping strategies, right. For those who have joined us a bit later on, we've already gone through a wonderful presentation by Prof. Mathai here. We are talking about psychological stigma among healthcare workers in the context of COVID-19. And I hope we've been able to catch up as we go through some of the questions and answers. At this juncture, I'll allow some of some people who would like to to ask some questions live. Allow one or two as we even wind up. Samuel Diwa, you can unmute and just ask your question. Samuel Diwa.
You're still muted.
He's still muted. Geoffrey Cheriot. Maybe they raised their hands by chance. Lucy Muchungu. Maybe they did.
Maybe they're not able to unmute.
No, I've allowed them to unmute.
Oh, you've allowed them,
allowed them to unmute. Yeah. Okay. Maybe they're not there. We can do one more question. And here we ask, what is the place of religious, what is the place of religion in the coping mechanism of stigma and COVID-19? Where do you place religion? What is its place?
Okay, that religion or spirituality is very important. The religion or spirituality, let me put it, is that feeling that there is a higher power. There is something beyond yourself, and that you're a part of a bigger thing, you know. you're not just a piece of wood. You're part of a bigger thing there. And so, without going into specific religions, spirituality is very important. And I will not say this is better than the other one, or this one or the other one. It is whichever it is you prescribe to. And the important thing is to keep at it, whatever it is. Never before have we needed this more. You know, it's so important. Every day, when I call, every other week, when I call my mother, say, we are praying for you. We are mentioning all the children by name and the grandchildren. It makes her feel good. It gives people hope. It gives you a reason for being. So I think for us in psychiatry, we say spirituality is very important. It doesn't have to be a specific religion, but spirituality is definitely important. And one of the self-care habits that we propose is a time you set aside for spirituality every day. So I hope that gives some answer without trying to preach.
Sure. That's well answered. Thank you. Somebody is requesting for highlight of the coping strategies. That one you had already gone through, but maybe just a short recap, Prof.
Yeah, okay. Coping strategies that we need. That's some of those what we call self-care habits. Important ones. Make sure you're eating well, nutritious food every day, fruits, vegetables, that you're drinking plenty of fluids. These plenty of fluids do not have to be plenty of alcoholic fluids. But I mean, I'm not saying that you don't have to drink a beer once in a while or whatever it is you drink, or wine, but I'm saying that your plenty of drink fluids should not be alcoholic fluids. It means also that avoid eating things that are bad for you. You know, sometimes when your people are stressed, they take sugar, they take soda, they take Coke, they take chocolate, everything to feel an emptiness that cannot be filled by substances like sugar or whatever other. Don't use drugs. A big problem with our health providers is the use of pharmacological substances, self-prescribed, and this becomes something that is common, particularly because sleep problems are common when there's in a stressful situation. Try to get regular sleep. It's good to set aside time for when you wake and when you sleep on a regular basis. I know you will tell me when I'm on shift, and this is also true. These are some of the problems that we have. And that is why a lot of health workers, sometimes when they get insomnia, they reach into the Valium business, and that is an additional problem. So in case of sleep problems, we do have other ways of dealing with sleep problem, like sleep hygiene, which is very, very useful. The other thing is to have exercise every day, at least 30 minutes of exercise. You don't have to pay money to go to the gym. You can even do walk on the spot. You can walk around. If you're lucky enough and you stay in a neighborhood where you can walk outside, the YouTube is full of stretches and things that you can do. So luckily for us, you don't really have to go to the gym at this time, and it's not very good. I wouldn't even advise it. So you need some exercise every day. You need your spiritual moment every day. You need to maintain social contacts, not physical, but social. You can do that on telephone. Make sure you call a friend every day or a relative every day on the phone. Find out how they are, because by finding out how they are, you're also getting your social networks are maintained. So maintain your social networks, even if you are not able to maintain them at this time physically. Don't lose your friends. Get time to confide, and sometimes it's in the health work, it's good to have what you call a buddy, somebody who understands your situation, where you tell them, today I felt like throwing away a syringe. They will not be, you wanted to throw away feet. You know, whatever it is you do when you feel so stressed in the health work, somebody who will understand you, say, yeah, sometimes you feel like that, and it's good to say that you feel like this. Yeah. So deep breathing exercises has also been found to be very, very useful. These are called relaxation techniques and mindfulness. Again, I want to say that because information these days is just a telephone away, if you're interested, you can find deep breathing or diaphragmatic breathing for the management of anxiety and stress, or mindfulness for the same reason. So these are some of the ones I can think of just offhand. But I think in a previous presentation, if you get the slides, you will find that I had made a list of these. And do them every day. Track yourself. What we encourage people to do now is to have a tracking form where you track yourself, to remind yourself, to be accountable to yourself.
Indeed, very important. Huh? Coping mechanisms.
Yes.
On how to deal with COVID, very important, and doing them every day. We have to find time within our busy schedules at this particular moment as you're going through the COVID-19 response. It's really important to find time for yourself, to just do a mental check and really do those exercises, eat healthy, avoid drink. Prof said drink drink a lot, but not alcoholic drinks in this case. Huh? Be healthy and stay healthy. How do we advocate? There's somebody interested in advocacy, and what advocacy measures can we use to address stigma on social media and the mainstream platforms? Any comments on advocacy on the same?
Yes, you can use all your media platforms, first of all, to debunk some of these myths and stigmas. And you can also start your own platform. You can blog if you are one of those ones who are good at that. You can repeatedly post positive messages and positive news and credible information in your social media group, in Facebook or Twitter, whatever it is you do, WhatsApp. What I find I find it difficult to resist is when people post forward negative messages through WhatsApp, and I immediately say, you know, this is not like this. So do that. Don't close your eyes and close your mouth and your ears against messages that are destructive. And so please, that you can do that. Everybody can do something. Everybody can do something. Yeah, yeah. Some at a very high level, the bloggers. Some are at webinars, and some at WhatsApp and Facebook. But let it be positive. Ask yourself, before you forward any message, ask yourself, who does this message serve? Is it really true? And who is it going to serve?
Indeed, you can always do something in a small way, in a big way. You can do something, and communication in the right way. Get the facts right before putting it out there. A comment here on how the stigma has been caused by authorities in dealing with the quarantine and isolation. We've talked a bit about this, some of the burial rituals and such, and how we can cope with such. For testimonies of those who have recovered, we will have still a series of these webinars. We had one, we had two actually for patients who had recovered prior, and even we had one for healthcare workers who had tested COVID positive and how they were dealing with it. And we were planning to still have more sessions on that. So keep in touch. We will have that. The other, if there are some who have been adversely affected by COVID, in that you've tested positive and going back to work once testing negative, you're still not allowed to work, or you've lost work as a result of having tested positive prior. Maybe a comment on this, Prof. How do we have hope or hold on to hope even when we have unprecedented when we have negative effects like this, like loss of work?
I'm assuming that is not a health worker.
No, it's actually from
No,
maybe
the person who was not allowed to go back to work was not a health worker.
We hope so.
Because if you're a health worker and your health provider is telling you that, I think the Ministry of Health should get into it very, very quickly, you know, because that's not the way we should be doing. but it could be outside anyway. It could be outside. But one of the things that is going to be very difficult is when you lose your job, let's outside of this or outside the state machinery, because people are losing their jobs even without having had COVID because of the economy. So it's a very difficult situation, and I think if you're in a state if you're not employed by the state, of course, this is not going to happen. If you're employed by the state, this will not happen. And if it happened, you can sue very quickly. But outside of that, it becomes very, very tricky. But the thing is to make the person see that it's not just because that you tested positive, because people are losing jobs because of the economy, that is in the private sector, and a lot of people have lost their jobs. So and give them hope. I mean, there's always a reason to look at, other ways in which you could maybe find something else that you can do. But I know it's a difficult situation. But I just said I hope it's not a health provider who has been let off because of having been infected. That would be a disaster.
Yes. I think there are good ways of dealing with this. How do you, another from anonymous attendee, how do you deal with a colleague who has a loose tongue, gossiping? We've talked about talking about each other and how we talk, how we refer to each other, even when we have tested positive or are undergoing investigation for COVID. There's a way as healthcare workers, we can be able to spread messages of hope and positive messages, not referring to our colleagues as cases or suspects, but as people, and really avoiding this. And some situations you might not avoid because you have control over yourself, but you don't have control over the other person. So how you deal with it personally, as Prof has put it, is really important. As we wind up, we'll have a question from John Waweru. You can unmute and ask your question. John Waweru, maybe that put it up also by.
Oh, okay. We are all learning how to deal with these platforms. It's a learning process. Yeah.
Yes. So as we wind up, I think we've covered all the sectors with the questions have been all round. Thank you for keeping, thank you all our attendees for being active and for listening in and for your questions and your comments. Indeed, it's a very important discussion on how we keep mental health intact during this pandemic. And just as a recap, we did a background of the same of COVID-19 being a new disease and how we are handling it, and as healthcare workers, how we are at the forefront, and we can get overwhelmed from both treating the patients and from us experiencing the stigmas from all sides, within ourselves, from our colleagues, from the community. And we've also learned of how to deal with the same, and even how to have some coping mechanisms. So for now, we'll come to the end of this webinar. It's been quite precise. It's been quite interactive. For CPD points, please email your CPD questions to knhcpd@gmail.com. That is knhcpd@gmail.com. For pharmacy, cpdpharmacy@gmail.com, and they will get back to you. If it has taken some time to get back to you, we are still keeping up with the numbers, and they will get back to you. Do email them. For now, as you see up, we are having on the screen, we have a symposium that is running. We have our medical legal issues in health, staying in the practice and out of court. That is coming Wednesday. We had our first session this Wednesday. Coming Wednesday, we'll have the same on the other Wednesday. Tomorrow we'll have sessions on COVID from the counties. For now, we'll call it a day, and we'll ask Prof. Martha, give us a parting shot.
Take care, stay safe, and practice your self-care habits every day. That's my parting shot. Thank you, Agnes.
Thank you. It's been a pleasure having you. Stay safe. Thank you.
Thank you.
Let us meet tomorrow.
Okay.